So in talking about resuscitating patients, giving them oxygen, intubations and all of that, right, we've spoken about all of that, made a lot of sense out of it. But sometimes intubation can fail. You understand? So when intubation fails, you now need to go in for, this last method, which is known as the FONA. That's the front of neck access. Okay? So front of neck access, just have to do it. I tried to intubate the person maybe through the nose, through the mouth, it has failed. So I just have to cut the neck open to intubate directly into the throat. You understand? So it just refers to what emergency technique. You are using it to secure the airways when what normal methods of intubation and maxing the patient for oxygen delivery has failed. Do you understand? So that's in a condition known as what cannot intubate, cannot oxygenate crisis. All right. So what procedure fall under the FONA? So there are different procedures. Do you understand? There are different procedures. So you are trying to bypass the upper respiratory airway. All right. You're just trying to access the throat directly, not from the mouth, not from the nose. Okay. So cricothyrotomy. This one is incision through the cricothyroid membranes. Okay, is the fastest and most common one used. You see this? Okay. Surgical tracheostomy, more complex, typically elective, but can be adapted for emergencies. Then percutaneous dilatational tracheostomy. Then Transtracheal Jet Ventilation. So if there's any of this technique that you want to actually know in depth about, just comment. Okay. But for me, I feel just knowing the front of the neck access as an emergency method of trying to ventilate patients is enough. Okay. So in cannot intubate, cannot oxygenate situations, all right, is this FONA, that's front of neck access, is like the last option you are going in for. All right, you have tried to intubate, you have tried to max up, it has failed, so you want to just access the neck directly. So it must be performed immediately to prevent what the case where oxygen supply to the brain has depreciated to a very long extent. Requires clear protocols, people that are trained, and equipment should be available for it. Okay, so that's what the challenge is. Landmark identification can be difficult in people that are so big, or people that fluid has accumulated in their body. That's edematous patients. Then stressful conditions may impair performance. Okay, so such medical providers should be very calm in such situations. So that's just what the front of neck access simply entails.